Notice: the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual health professionals or patients. Thank you. Antisocial Personality Disorder, ASPD, is a mental condition characterized by a long-standing pattern of disregard for other people's rights, often crossing the line into violating those rights. Individuals with ASPD typically exhibit behaviors that are hostile, manipulative, and deceitful, with a marked lack of empathy for others. This disorder is not merely about being antisocial or withdrawn. It involves extensive disregard for societal norms and the well-being of others. People with ASPD may engage in behaviors such as chronic lying, using charm or wit to manipulate others for personal gain or pleasure, displaying significant arrogance and a sense of superiority. They often have a history of legal problems or aggressive acts, such as physical fights or assaults, stemming from their disregard for the law and the rights of others. Impulsivity, failure to plan ahead, persistent irritability, reckless disregard for the safety of self or others, and consistent irresponsibility are other hallmarks of this condition. A defining characteristic of ASPD is a lack of remorse, illustrated by indifference to or rationalization of hurting, mistreating, or stealing from others. The diagnosis of ASPD is complex and requires a thorough evaluation by a mental health professional. The criteria for ASPD include evidence of conduct disorder before the age of 15 and a continuation of antisocial behavior into adulthood, with the individual being at least 18 years old at the time of diagnosis. The etiology of ASPD is believed to involve a combination of genetic, environmental, and psychological factors. Genetic predisposition may play a role, particularly if there is a family history of the disorder. Childhood experiences, such as exposure to abuse, neglect, or traumatic events, are significant risk factors. Neurobiological factors, including abnormalities in brain structure and function that affect impulse control and emotional regulation, may also contribute to the development of ASPD. Treatment for ASPD poses challenges, as individuals with the disorder may not seek help voluntarily due to a lack of insight or remorse. Psychotherapy, particularly cognitive behavioral therapy, may offer some benefit by helping individuals recognize the impact of their behavior on others and develop healthier ways of interacting. However, treatment efficacy can be limited, and long-term management often requires a comprehensive approach that includes monitoring, support, and sometimes legal intervention. Medications may be used to treat concurrent issues such as aggression or depression, but there is no specific pharmacological treatment for ASPD itself. Managing ASPD requires a multifaceted strategy, ideally involving mental health professionals, community services, and possibly the criminal justice system. Early intervention and consistent, long-term support can play crucial roles in improving outcomes for individuals with ASPD, although the pervasive nature of the disorder often means that management is an ongoing challenge.